ಎಲ್ರಿಗೂ ನನ್ನ ನಮಸ್ಕಾರ. Good evening, everyone. First of all, my apologies for not getting connected due to network. No, it's still streaming. ಎಲ್ರಿಗೂ ನನ್ನ ನಮಸ್ಕಾರ. Good evening, everyone. My apologies for not getting connected due to network issues. Today, I am here to give you an idea about what is happening to persons with autism spectrum disorders during this uncertain issue of COVID-19 outbreak, which is a concern throughout the world. Now, before I begin talking specifically about how the parents should be dealing with children during these situations, let me give you a few idea about how does autism look like. Let me tell you, for example, you have a child with some hypothetical name like Naveen, who's probably 2 years old. Now this child always prefers to remain and play aloof, which means that he does not mingle with the other children and he likes to play just on his own. So this child, as we see, is not communicating or using any form of speech to convey his feelings, ideas, or any form of desires. Now, this child is 3 years old, and you see that he is pulling out his mother to express his needs. Further, the child might start speaking, say around 4 years of age, but what does he speak? He says, if the mother asks a question to him, "What is it that you want, Naveen?" He says, "What is it that you want, Naveen?" So if you observe, I was just telling you that he's just repeating whatever his mother is saying, which is also not communication. Ideally, when a question is asked, an answer has to be given. So this situation is called as echolalia. Okay, so now let's see what is happening to this child who we suspect to be having autism spectrum disorders. So I mentioned to you initially that this is a child who's 2 years old. He's not even mingling with his family, and he's always remaining and trying to play aloof. He's not even mingling with his mother, his father, his own siblings. Further, we see that this child is not expressing himself, even though he's 3 years old. Now that he's a little grown up, he's just pulling out his mother for whatever he needs. And further, you might also see that this child is speaking, but what is it that he's speaking? He's just speaking whatever the mother is speaking, which means he's echolating. He's just repeating whatever the mother is saying, unlike answering her questions. So this is what you might typically see in children with autism spectrum disorders. So in autism spectrum disorders, some of these symptoms or all of these symptoms might be seen. So as we said that it is a spectrum, so you can see a range of difficulties in these children, right from having socio-communication problems to having stereotypic or repetitive restricted behaviors. So you see this child Naveen is sitting and just playing with only one toy, and he's repeatedly moving the wheels, or he's just repeatedly giving the key of the toy, or he's just repeatedly taking the toy and putting it on the table. So he's not using any other toy that is around him, but he's only obsessed with one particular toy that is there around him. And then when the mother takes and picks the toy and puts it on the table, Naveen gets agitated. So why is Naveen getting agitated? That's because these children generally prefer to be insisting on sameness. That means they want particular things to be in particular position or in a particular way. And that is why we say that they have a highly restricted behavior. Apart from that, you might also see that these children Whenever there are people coming to their homes, people whom they know or their close family members, they tend to be socially isolated. They don't like mingling with the other people. So as soon as somebody comes, they might just get inside the room. So this is again another aspect that we see. So now professionals call this condition as socio-communication disorder with stereotypic behaviors. So, seeing some of these characteristics and understanding the situation, let us now just understand scientifically and technically what is this autism spectrum disorder. Let me tell you, autism spectrum disorder is not something that the child is doing deliberately. The parents and the public need to understand that this is a neurodevelopmental condition which is having various factors to it without any unitary cause specifically. So, when it is a neurodevelopmental disorder, generally you see that most of their developmental skills, maybe with respect to their social development, their communication development, their sensory development, to some extent, their fine motor development could also be affected. But most children with autism look as normal as the other children do. So, it is very difficult to detect them just because of their features. So, hence, you will see that professionals will tell you that it is a little challenging to identify these kind of children with autism spectrum disorders. So, World Health Organization, which we are all familiar with, we know is coming up with prevalence rates of saying at least 1 in 160 children having autism spectrum disorders, which is quite high. So we've also had studies in India which have proven and said that they've been able to find out that at least 1 in 125 children in the younger group are able to be identified as children with autism spectrum disorders. So now this is a bigger concern for us because we see that there are a lot of children around us who might have this condition but are not really detected. Also, remember there are various emotional challenges that these children with autism can face. Very simple thing is, the child does not even identify that somebody is in a particular emotional state. The child also may not be in a position to express that emotional state. So, obviously, you will see that the child is just crying or laughing without any obvious reasons. And often these children also show up with social withdrawal. So whenever there's somebody coming into the families, whenever they're coming into their schools or classroom, these children find it uncomfortable to face them. And as I said before, autism spectrum disorders does not really have a unitary cause. So there are various causes speculated for autism spectrum disorders. These could be genetic, and it's also been seen that most children who are identical twins have higher chances of having autism spectrum disorders. So one of the twin has autism spectrum disorders, there are greater chances the other twin also has autism spectrum disorders. So that is how there have been certain genetic evidences. So scientists are constantly working on finding out what are the genes that are responsible for autism spectrum disorders. There could also be a neurobiological reason. So that's why you see that there are certain regions of the brain which are not organized the way they are organized in a healthy individual within the same age. Other factors that are speculated are dietary factors and certain exposure to drugs and to environmental toxic substances. Now, the concern is how early can this autism be identified? According to our reports, autism spectrum disorders can be identified as early as 2 years of age, but there have been reports which also say that there can be certain signs can be identified to call them as at risk by 6 months of age itself. Now, some of these signs that we can look out for are signs like, lack of social smile, lack of eye gaze responses, which means to say the child is not really facing the person and speaking. It's often seen that young babies, much lesser than 6 months of age itself, can make a very good eye gaze with the mother as well as the object of reference. So when I say that, I mean to say that a baby watches the face of the mother very early, okay, and also it is able to indicate through its eye gaze itself that where the object of his like is. So suppose there is a toy that is lying down, the baby can actually indicate through its eye gaze that it wants that toy or it wants that object. Whereas you see that children with autism have not been able to do this. And we've had a lot of parents telling us that retrospectively, when we ask them questions, they tell us that these children never did that. They never looked at their eyes, they never expressed their wants and their desires. So these are considered to be early signs for children at risk for autism spectrum disorders. Now, why are we stressing so much about identifying these children so early? So we've had a lot of children with autism coming to our institute, and we have very clearly seen a pattern in our clinics that all those children who have come early in their life to get services from us and who were identified very early have actually done very well, and they are almost as productive as the other typically developing children are. So we have had a lot of success stories on these. I could even probably mention about Tito Mukhyopadhyay, who is a very successful writer. So if you can browse through, you will get his details on that. So you will also see that most of the things that he expresses through his writing. So we've also had the privilege of having certain children with autism with us who are now doing their post graduation in music studies, and very successfully they have completed their post graduation. Some of them who are also into a lot of activities like dancing. We've also had one of our children with autism who is serving as a software engineer. So we've seen a lot of successful stories, especially of those children who have been identified very early in their life. Now, why early identification? To tell you more scientifically, what happens with our brain is a period from birth to 3 years, you'll see, is the most crucial period for development. That is because at this time, our brain is considered highly plastic, which means to say that how much ever we are able to give out changes to the brain to reorganize itself in a systematic way, the brain is able to do it. But if we are doing it much beyond the critical period, so 0 to 3 years is considered the most critical period, and till 15 years is considered as the critical period. So there are changes happening after 3 years as well, but the changes that happen between 0 to 3 years is much more rapid. And that is the reason we stress that most of these conditions need to be identified as early as possible. Now you can ask me, what is the cure for autism spectrum disorders? Is there a cure at all? To say it in the true sense, there is no cure for autism. But, however, children with autism can be intervened and they can be managed with the help of various professionals who are involved in the condition. So, we have a team of professionals who are involved in treating autism spectrum disorders. Say, for example, the behavioral issues that I've talked to you about, or I mentioned about this child called Naveen in the beginning. So, the behavioral issues can be taken care of by a psychologist. The communication problems or the speech and language problems are usually catered by the speech language pathologists. The sensory issues are taken care of by the occupational therapists. The educational guidance is given by the special educators. And apart from this, we also have family as a very, very important part of the team member whose involvement is very much important, probably more than anyone else in the team that I just mentioned to you. So, parents, please remember to involve yourself along with the child, and remember that these children do have special abilities. Like they might be very good in remembering certain things, their memory might be excellent, they might be very good in singing or dancing, in writing, just the way I mentioned before. But it may not be true for all children. This is what I want to stress upon. So they may be good at certain skills. It's good for you people to identify these skills and nurture them. But remember, it may not be there in all the children. And autism spectrum disorders can often be associated with other conditions like intellectual disability. We've also had children with hearing impairment who've had autism spectrum disorders. So the line of management will again depend on the kind of associated conditions they have. Or otherwise, autism spectrum disorders can be there Even without intellectual disability or without hearing impairment, it can exist in isolation. So, with that information, a bit of information about what this condition, autism spectrum disorders, is all about, I would like to tell you that there are certain points as a professional dealing with autism that I would like to put across to you. Probably you can utilize these points in order to cope up with this kind of an uncertain situation of COVID 19. Now we know that all of us are worried, all of us are anxious, all of us are stressed because of this condition, because we are not in our normal life as of now. And probably the burden is even more on the families who had children with autism spectrum disorders. But remember, there is a way out for everything. First of all, to bring out a bit of awareness, again stressing on points that the government of India has been putting across, I would like to say, please do follow the guidelines that are provided by our Ministry of Health and Family Welfare on our best practices to prevent COVID 19 infection. This is very important. And most importantly, please stay home, stay safe, and stay healthy. The next point is, many of us think that it is not so much required to explain to our child with autism about what's happening in the world now. But on the contrary, I think you should do it, because these children have a tendency to get frightened if they are not told in a particular way. So, yes, I would suggest that please communicate to your child with autism on the facts that are related to this COVID 19 infection in a way that a child can understand. Generally, for children with autism, we see most of them do very well using the visual communication strategies. So, I would suggest that please follow social stories, use pictures, use stories to explain to them in a sequence. Say, for example, a very simple story could be like you're talking about a good boy and a bad boy. And a good boy is always following what is said by the parents, and a bad boy does not. A good boy does not go out when told by the parents, whereas a bad boy is. So, all of this has to be put up in the form of pictures. So, when you do it with the pictures, you will see that the children understand better. So when we talk about germs, you could also say something like, talk about good germs and bad germs. Tell them that how bad germs can affect their health and make them sick. Also tell them that how bad germs have been affecting so many people outside, because of which we are unable to go out. Also tell them what a good boy should be doing. A good boy should be avoiding germs by washing the hands more frequently. So show a picture of a boy washing the hands. Also tell them how it is important that they're supposed to take all precautions to stay home. And also tell them ultimately that once the bad germs are gone, all of us are going to be fine and we can move around as we were before. So these are some of the strategies that you'll probably use doing more with the help of pictures, or picture stories, as I would call them, or probably social stories, as I would call them. Remember to use more pictures and less talking. So let the pictures do all the talking for your child. And most importantly, remember these children are supposed to be made safe by felt safe by the parents. So tell them that it's okay to feel like this. It's fine, it happens, but their parents are always there to support them and help them to come out of this. Now, the next point that I would like to tell you is, I know a lot of therapy services got cancelled suddenly because of this situation. However, we as professionals are making all our attempts to connect with you, counsel you, give out guidelines to you during these services. So please utilize these services from us during this time and let us know what you feel during the situation. It is requested also from the parents that please prepare a visual schedule for children with autism, trying to tell them what they have to be doing in a routine. So, framing a routine for these children is very, very important. And remember, the routine is disturbed, and children with autism always find it difficult to follow a changed routine. So, now it is important for the parents to sit with the child and explain to them why the routines are changed, and also reinforce the child, encourage the child to to let him know that yes, now you're following the routine as per the schedule that is prepared for you. So acceptance of change of routines is something that you really need to work on with these. Further, you can carry out a lot of social communication activities. You could also do social plays with the siblings, with the family members. Sit together, play a lot of games which probably require motor skills of the child, which also requires their cognitive abilities, which also requires their sensory abilities. Some of these games which we used to play earlier when we were children, there could be games like Ludo, there could be games like, Carrom board, forming stories or connecting with respect to watching how each person is reacting to a particular topic. So all of these kinds of activities can still be done. Plan out for the physical and sensory based activities and include them in the schedule if possible. Use a lot of gross motor and fine motor activities with the materials that you already have, and they can be as simple as, like watering the plants and asking the child to arrange the utensils or books or doing a jumping activity. And sometimes the sensory activities can include activities like kneading a dough, transferring the cereals, feeling the texture of pulses, feeling the texture of various clothes. So all of these can be done. And remember, involve the child as much as possible in the household chores, so that it doesn't become stressful for the parents, and it doesn't take away the time from the child as well. So you could have the child helping you in the kitchen, you could have the child helping you at home in your cleaning and all of these purposes, and make the activities as meaningful as possible. I'm sure when you do this, you will enjoy, and the child will also enjoy. And I'm sure your stress levels, your anxiety levels will be lowered down. And for any suggestions or guidelines, please contact your professionals. And from AIISH, as all of you know, a lot of you have been given your home training programs. A lot of clinicians have given your activities. So if you have anything or anything further of help from those activities, you can please contact your clinicians. You can also contact your professionals. And parents, this is my suggestion and advice. Please be patient, please be stress free, and try to be as realistic as possible. Don't take too many things in a day. We understand it's going to be difficult for you. It may not be the same thing as you did before, but take things one by one at a go. And on a day, if you haven't been able to do 10 things for the child, it is fine if you're able to do even 2 things. But just remember, your calmness, your patience, your reduced anxiety level is equally important for the child, because the child is watching you and the child is living along with you. We would also suggest, finally, that our telesessions are still open. And if you want to avail the services, you could still do it. Please contact us and let us know if you need any help on this. And at the end, please remember to stay home, stay safe, and stay healthy, and hope for the best. Thank you. I hope this was useful. And if there's anything that you want to connect with me or you want to ask your queries about, please do in the chat, and I'll be very happy to answer these questions. Thank you and have a good evening.